Welcome to this introduction to the Sotair device, a flow control device that improves safety during manual ventilation. Sotair is a flow control valve that fits between the manual ventilator and the adult patient's mask or advanced airway device. It limits the maximum flow rate to 55 liters per minute, ensuring that air delivery stays within safe limits. Controlling flow reduces the risk of high peak pressures, excessive tidal volumes, and excessive breath delivery rates, all of which are important in order to avoid patient harm when delivering breaths with a manual ventilator. Research has shown that high peak pressures during manual ventilation can lead to complications such as vomiting, aspiration, acute lung injury, barotrauma, and ARDS. By controlling airflow, Sotair helps maintain peak pressures within safe levels specific to each patient. Sotair maintains a constant max flow limit of 55 liters per minute, and the peak pressure delivered is automatically adjusted based on the patient's airway and lung compliance, making it suitable for any adult patient. Sotair reduces variability in excessive or inadequate tidal volume delivery as a provider delivers a breath over 1 second near the flow limiting threshold. By acting as a forcing function, Sotair forces the right actions to deliver max airflows less than 55 liters per minute, avoiding rapid, forceful squeezes that lead to overventilation. By maintaining a squeeze of the bag to 1 second and under Sotair's flow limit of 55 liters per minute, providers will avoid delivery of excessive tidal volumes. Because the device tends to slow a provider down, the provider is less likely to deliver a large number of breaths per minute. This decreases the risk of hyperventilation. If the bag is squeezed too quickly or forcefully, Sotair's valve closes, creating a resistance in the bag, producing alarms realized by the user. Alarms are tactile and/or auditory with visual cues. These alarms indicate when Sotair's flow limit has been exceeded, prompting the provider to adjust their technique in real time. This intuitive feedback makes training easy and reinforces best practices in real time. If you feel or hear Sotair's alarm activate, immediately release the bag and pause until the next breath cycle. Do not continue to squeeze the bag if Sotair's alarms are generated. Try a longer, slower squeeze to keep within the safe flow and pressure range, avoiding further activation of the alarms.